Thank you for joining us virtually for a press briefing. My name is Kelly Chandler, the Public Health Division Manager for Itasca County. We are hosting press briefings in Itasca County every other Thursday to address COVID-19 related issues and questions. And today our focus is gratitude. Intentionally focusing on gratitude improves our physical and mental health, our relationships, our sleep, self-esteem, and empathy. Gratitude decreases pain, decreases aggression, and poor mood. And very importantly, it promotes resiliency or the ability to cope with stress and trauma. And that's something we all could use after the last year we've had. And as challenging of a year it has been in Itasca, we do have so much to be grateful for since our first case of COVID was identified in Itasca County on March 29th, 2020. We have 41% of our Itasca County residents beginning their vaccination series, and 9,868 of our residents have completed their vaccination series. 76% of our Itasca seniors ages 65 and up have been vaccinated, and that is such a great step in protecting those who are at highest risk of poor outcomes from COVID-19. As grateful as we are to have made this progress, we do have reasons to continue to be cautious. 2 variants in the coronavirus have been identified in Itasca. The most recent is the B117 United Kingdom variant, which contributed to some spread in a youth organization within the past month. This is a reminder that we're not out of the woods and we are in a race to get vaccines in arms, as the vaccine is believed to be effective against the variants. Of course, we still need to wear our masks and maintain a 6 feet distance from others until we are at a point where a majority of our eligible population is vaccinated. We're so grateful for our Itascan neighbors, friends, and families who have made sacrifices to keep our community safe, keep our businesses open, our children in school, and slowed the spread of COVID. Stay strong, Itasca. We're not out of the woods yet. Vaccines are open to anyone 16 and older. Please note 16 and 17-year-olds may only receive the Pfizer vaccine, and this is accessed thus far at hospitals, Leech Lake Band of Ojibwe, and Thrifty White Pharmacy in Itasca. Walmart, Scenic Rivers, Thrifty White, Big Fork Valley, and Public Health also have the Moderna vaccine. We are patiently waiting for Johnson & Johnson vaccine to become more readily available, and we encourage you to take the vaccine that is currently available to you. And if for some health reason needing Johnson & Johnson, keep checking back to these briefings, our written media releases that happen 1 to 2 times a week, all of our agency websites and Facebook for availability. We are grateful that 3,267 Itascans with COVID-19 are no longer isolated out of a cumulative total of 3,444 cases, which were identified this past year. This past week, we identified 89 new COVID positive cases and 172 in the past 14 days. The 14-day case rate per 10,000 as of March 28th is 39. This number has been steadily increasing in the past 4 to 6 weeks. Thank you again for your sacrifices, for keeping your mask on over both your nose and your mouth, avoiding large gatherings, and especially if you are not fully vaccinated. We are grateful for our media who joins us every other week for these briefings and for reaching out to us to receive local information. Following our speakers, we will invite questions from the media via chat with your name, the organization you represent, and we will direct questions to our panelists. And we are very grateful for our speakers today. We plan to hear from Dr. Dan Suler, Vice President of Medical Affairs and Family Practice Physician, Grand Itasca Clinic and Hospital, Jason Anderson, Director of Itasca County Probation, Karen Arnold, COVID survivor, entrepreneur and area resident, Caroline Ahcan, high school sophomore and restaurant worker, Angie Berg, assistant principal, Robert J. Elkington Middle School. We will now hear from Dr. Suler, Grand Itasca Clinic and Hospital.
Morning, Kelly. Thanks for having me back on this panel. I appreciate being a part of the group that's speaking this morning. So I just want to take a few minutes to touch on a couple topics that are very common in the news right now that we hear a lot in clinic. One is on the COVID variants, and the other is just some updates on some vaccine information. So first, I'll start with some information about COVID variants. So variants with viruses are very common. It's in the best interest for the virus to continue to mutate and change to be able to be transmitted from person to person as easily as possible. That's how viruses survive. Viruses generally don't have the interest of killing their host or killing humans. And so, what we're seeing is very, very common, very normal in nature with viruses changing. As Kelly mentioned, there are multiple variants that are identified, several of which are in our area in Itasca County, specifically the United Kingdom variant. We do know that this is more easily transmissible from person to person. Thankfully, there's 2 points I want to point out. First of all, the vaccines seem to be effective against preventing hospitalizations and death from this variant, so that's great. And secondly, the further information will be coming out regarding how well the vaccines will prevent transmission of this particular variant. Just an item of information for variants. So in Minnesota, if you test positive for COVID, you test positive for one of the variants. The COVID test is very good at identifying whether or not you have COVID. It doesn't tell us at a clinical level which variant you have. What happens in Minnesota is all the labs in the state will send a percentage of their positive COVID tests to a specialized lab to then identify if that virus is one of the variants or one of the original COVID viruses. So right now, 10 to 15% of all of our positive tests get sent away to look for clusters of variants. And as Kelly mentioned, we have been able to identify local spread with one of these variants through that testing process through the state of Minnesota. Because we don't know which variants people may have when they test positive, that's all the more reason that we need to continue with our public health measures of preventing spread of COVID-19, including continuing to wear that mask, staying 6 feet away from others, trying to avoid large gatherings, washing your hands often, and probably most importantly, staying home if you're sick or have been in close contact with someone who has COVID-19. We here at Grand Itasca and throughout the community, we're seeing a lot of folks trying to sneak back into work, to school with some minor symptoms, and that's just helping fuel the fire of this current spread right now. One other item I'd like to mention is that the state of Minnesota does have a couple of recommendations for families with school-age children, especially as more and more kids are getting back to school throughout the state and getting back into sports. So the state is recommending that school-age children get tested every 2 weeks. And again, that's because a lot of those folks don't have symptoms and they can spread this virus very easily from person to person. Testing can be very easy. It can be done through the state with saliva testing, so it doesn't require the nasal testing, which isn't the most pleasant thing to go through. And kids that are involved in sports and after-school activities are recommended or encouraged to get tested once a week. Again, if we can identify one kid that has the virus, we can snuff that out real quickly versus waiting for that virus to spread throughout the team or activity. Just a couple of items about vaccines that we've learned as we've been giving them out since December. I just want to reiterate that rates of side effects for vaccines are very, very low. Early on, some side effects caught a lot of national attention, but I can tell you in the real world, what we're seeing is the rates of side effects are extremely low. Here at Grand Itasca, we've given over 5,000 vaccines here. We've seen very little side effects from those folks. So again, real world experience is much different than what the news likes to portray. A very exciting study came out this week showing real world efficacy of all 3 vaccines is greater than 90%, which is wonderful. That's about as good as it gets in the world of vaccines. I did want to touch on a report that came out last week in Minnesota that 89 individuals who were fully vaccinated tested positive. If you get into the details, a lot of those positive tests came from asymptomatic testing. And so what happens is in a lot of nursing homes and assisted living facilities, we're still testing all residents and employees on a regular basis. And so a vast majority of those positive tests came in those individuals. And so the good news is they were asymptomatic. I can also tell you as of this morning in our system, the mHealth Fairview system, there's 101 people currently hospitalized with COVID. Only one was fully vaccinated. So we're very nearly getting to the point where, in my opinion, COVID hospitalization is going to be preventable. We're just not seeing people that have been vaccinated get hospitalized at a rate that's significant. Once again, I want to just reiterate that so far early evidence does suggest that vaccines do reduce transmission from person to person. Again, I've harped on this in the past. The early studies were not designed to evaluate that, but so far evidence in Israel and now coming out in the United States does show that it does reduce transmission, which is great news because that can help inform our public health colleagues regarding mitigation measures such as distancing and masking and whatnot. So with that, I'll turn it back over to Kelly and the rest of the panel and look forward to any questions that may come from this. Thanks.
Great information and up-to-date information. Thank you. We will now hear from Jason Anderson, Director of Itasca County Probation.
Thanks, Kelly. Yes, I'm Jason Anderson. I'm the director here at Itasca County Probation. And boy, I know most of you, when you think probation, you think about gratitude, right? Well, I think it really is a choice. And being an optimist really is a choice. I love this Churchill quote. Winston Churchill said that I am an optimist. It seems not too much use to be anything else. It seems not too much use to be anything else. I love that. And I love the fact that, I mean, let's be honest, Churchill came through some pretty tough times, pretty dire and dismal circumstances. Yet in the midst of that, he still chose to be an optimist. Dire and dismal might be how a lot of us would describe the last year, you know, this whole COVID pandemic stuff. And that's honest and that's sincere, that's real experience for a lot of folks. And at the same time, we can choose to see the good. I mean, we you know, honor the struggles and honor that it's been hard and it's been economically difficult. And, you know, we've all known loved ones who have been very sick or even lost loved ones. And I'm not trying to make light of that. But we can just stay there, or we can choose to see how we see the world, right? And it might sound really simplistic, but we do literally get to pick what we think, right? We get to pick what we think. You know, rather than just brood and worry and lament, we can seek out like reasons to be grateful. We can cherish times, and I think we've all probably done this. We've more thoroughly cherished times with friends, with family, with coworkers. You know, as workplaces get to be more and more, you know, back to normal, getting to be around your team. And we can also seek out opportunities to improve ourselves, but to improve processes and improve practices and policies. You know, there's that saying, and I love it. It's helped me a lot in the last year, is you never want to waste a crisis. You never want to waste a crisis. This has been a crisis. There's been, you know, a crisis on the scale we've never experienced and hopefully we'll never experience again. But boy, have we learned things, right? I mean, we've all probably learned things about ourselves, and we learned personally about what we cherish most because we don't have some of those things. How, you know, relationships and opportunities with other folks. But professionally, we've been compelled to examine like at the core what our work is. And for the probation department, we've had to, you know, do some honest work around that and deciding what are the things that we do just because we've always done them that maybe we could do differently. We've learned, you know, the merits of increased field work, going to see people out in the community at their homes, well, in their yards, you know, we did a lot of that, versus having more folks just come to our office and that sort of a deal. We're all over it when it comes to Zoom, and I know here we are on Zoom or Teams or whatever. But I can't tell you how many times, probably 3 or 4 times a month pre-COVID, I would drive to the Twin Cities for a 1 or a 2 hour meeting. It would suck my whole day. It'd be a day killer for a 1 or 2 hour meeting. And I miss those meetings, and I miss getting to have that personal interaction with my colleagues and my peers. But a lot of those meetings, we can be really effective in a virtual platform. And we've known the technology isn't new. We just we're never compelled to use it. So we've increased some of that. That's been a great thing. The other thing that I think has been a great thing that's come of this, that can have some residual effects, is an increased awareness on the public across the whole continuum of increased awareness of the need for prevention. Now, of course, you know, early on it was cough, you know, into your elbow and wash your hands to death, and, you know, wear masks, you know, prevention efforts, and now vaccines. But, you know, in my industry of probation, the thought of spending more resources and giving more effort and attention upstream in preventive efforts, that's that's welcomed. Let's go there. Let's spend more time there. So lastly, I think, well, let's just be honest. Absence makes the heart grow fonder, right? We've had to do without a lot over the last year and some change. We've had to do without a lot of interaction. We've had to do a lot without, certain economic opportunities and businesses, and worship has been limited. The ability to worship the way you did, or in person, or singing and those sorts of things. The plug was pulled right before Palm Sunday last year. Here we are in Holy Week, right? And so that point isn't lost on me, that we missed all of that last year, and this year we were able to be back and in those places of worship. And Easter is a period of rebirth and new, and I've found in my own faith life that the joy of Easter morning isn't quite the same if I don't take the time to go to that Good Friday service and really kind of enter into the loss, the sacrifice, the gravity of what it's about. I mean, we've been 12, 13 months of loss and sacrifice as a not just a nation but a world. So coming out, beginning to really come out the other side of that, we have abounding reasons to be grateful. So that's your dose of positivity from the probation department. Thank you guys so much for having me.
Thank you. And we will now hear from Karen Arnold, COVID survivor, entrepreneur, and area resident. And Karen's camera is not working, but she is here with us via audio. So welcome, Karen.
Okay, seems I was having a problem with my mute too. I've been sitting here for the last number of minutes trying to get my camera to work, and it just worked 2 days ago on a meeting, so I'm not sure. Got the little green light staring at me, but anyway, I'm Karen Arnold, and I grew up in Grand Rapids, and then went away to college and have lived in the cities for 35 years, and we're just in the process of moving back up to Grand Rapids. And through COVID, we've been in Grand Rapids all winter long. Our house down here is kind of full. I've got a daughter that moved back in to save money to buy a house, and so we've spent a lot of time up in Grand Rapids. And through it all, my husband and I have been very, very bubble centric, I guess. I'm tired of hearing that word bubble. But our bubble is very small. It's just us. And we thought we'd made it through. I mean, we were at the point where we're both 60. So at the point where we're able to get our shot, and then we got sick. And we think we got sick because my husband went to a hockey game in Cloquet to watch my nephew play hockey. And even though he was very careful and did all the things that we always do, we can't trace it to anything else. And so we've been so very careful because I have a lot of the comorbidities that they talk about when you can get sick with this, that it makes it really bad. I've got rheumatoid arthritis. I've got ankylosing spondylitis. I've got bad lungs, you name it. And I'm down that road, and it's pretty tough. But you know what? I've never been one to not just keep moving, because even when you have a lot of rotten things going on, the worst thing you can do is stay in bed and feel sorry for yourself. So, I just keep moving around the house. And it's fun because we're getting ready to do construction on our house. So we've had a lot of projects going on that keep me house centric, but keep me moving. At any rate, he got sick, then of course I got sick. And while he lost his sense of taste and smell, and had a pretty rotten cough, and was really truly in bed for about 2 days. The second day of my illness, I ended up going to the hospital, and I did a video chat with my doctor, and she said, I don't even know why you waited. This is just stupid. Get your butt over to the hospital. So I went to Itasca, and the ER doc took one look at me and said, we can't deal with all of your comorbidities, so we're going to send you to St. Mary's in Duluth. And they were very kind. And it's so scary when your husband has to drop you off at the door and you walk in by yourself and you're just sit there to face with whatever happens. Sorry about that. Still feels emotional. So they put me on an ambulance and sent me to St. Mary's. And for 9 days, I was, well, the first half of it, I was in intensive care. I did not end up being on a ventilator. Thank the Lord. But I was on pretty high oxygen and lots of drugs. So I did get remdesivir. I did get convalescent plasma. And I'm certain that those are drugs that saved my existence. And it was a really strange experience. You sit in a hospital room and doctors and nurses come in on a very specific schedule. They're there as short a time as they can. And because they're working furiously to save their health. And no visitors. And it feels like an alternate world almost. But everyone I touched in the system was so kind and so understanding. And I just appreciated that so much. And even on the day that I got to go home, the room that I was in had a big, huge, almost sounded like an airplane engine. It was a 1-for-1 air exchanger that was taking air out of my room and circling it, big hose out the window. And I asked the nurse, doesn't that just suck all the germs out of the hallway into my room if there's that much negative pressure? And she said, no one's ever asked that question before. So that was the best answer I got. So I just kept breathing through my mask. At any rate, they must have been very clean germs because I healed relatively fast for what they were expecting. So I'm so thankful to still be here for Christmas, for Easter, and being able to celebrate it. And unfortunately, we won't, even though our church is open, I just can't take the chance of going to church yet. So we'll just be very thankful that I'm still here to talk about it. And that is no joke. It was scary. But I'm just so thankful for all of the kind people that there are in this world that take care of people that have problems that I do. So anyway, it was excellent. Thank you so much for inviting me to chat here today.
Oh, thank you so much, Karen. That was so powerful. And we appreciate you being willing to share your story and that you're still here with us. We will now hear from Caroline Ahcan, high school sophomore and restaurant worker.
Thank you, Mrs. Chandler. My name is Caroline Ahcan. I am a sophomore in high school. I have a job at a local restaurant as a cook and a server. My employer has been super careful and really creative about making our restaurant safe for our staff and our customers. I can see that it's definitely not easy. The rules change a lot and it can get really confusing, but I really appreciate everybody's efforts because I'm a frontline worker. People like me have been helping the community throughout the pandemic, and we've been at high risk to COVID exposure the whole time. There are a lot of kids like me working at gas stations, waiting tables, checking people out of grocery stores, just trying to stay productive and bring home a paycheck. Like me, a lot of kids are still too young to get vaccinated, so we're depending on our friends who are over 16, our employers, and the adults in the community to do the right things, and most of them are. A couple more things I'm grateful for. I can't believe I'm saying this, but I really appreciate that we've had access to COVID tests. I've had 5 of the nasals so far, and I'm super thankful that healthcare workers have stayed working for all of us, no matter what. Teachers too really appreciate how much we've been able to stay in school and how optimistic the teachers have been. It was almost exactly 1 year ago that spring sports, my spring sport, was canceled. I couldn't believe it. So thank goodness our communities have brought down the spread so that students can have sports again, and hopefully prom and graduation, even if we are wearing masks, as long as we have that. And most of all, I appreciate people for sacrificing things. So not gathering in groups, wearing masks, preventing the spread of COVID, so that we can all start to do more normal things again. Thank you, Kelly.
Thank you, Caroline, for coming on, especially a day off from school. And we will now hear from Angie Berg, Assistant Principal, Robert J. Elkington Middle School.
Hi, Kelly. Thank you so much for having me. Jess Sutton has kind of volunteered me for this as a administrator, but also as a parent. So I want to start with my gratitude towards our nurses. The amount of work that they do within our buildings to make sure that our kids stay safe as possible is amazing. Between contact tracing, doing spit tests every 2 weeks. And now I know Dr. Suler had talked about the kids getting tested. Well, we're actually accepting spit tests from kids who are outside of the school, and we get those delivered. So between testing, contact tracing, making the phone calls, the really tough phone calls to parents, the ones that we don't want to get, saying, hey, you're a close contact, managing the attendance when kids can come back and when they have to be gone and how long they have to be gone. And above that, still running our buildings for the normal, the diabetes, the scrapes, the bruises, the cuts. They are running nonstop and doing such an amazing job. And because of them, that's how we are able to stay in school and keep our kids here so they don't have the learning loss that's expected. So really, really grateful and thankful for them, and absolutely amazed. The second part of this that I'm extremely grateful for in this position, the mask management. And I don't know if you guys have had an opportunity to walk into a school of 900 to 1,000 kids and look at the mask wearing taking place. I would say 99% of the kids are wearing them properly, are diligent about it, above the nose, over the mouth. And when that's not, and they have a reminder, it doesn't take much. You just go like this and they pull it up and they know. So kudos to our teachers and everybody in the building who is really, really taking the mask management seriously, because that's what's keeping us here as well. On another note, from a parent side, I have 6-year-old twins who are in kindergarten and a 9-year-old. And for the distance learning piece, I was actually in the building and my husband was taking care of the kids when they were distance learning. And his comment to me was, I don't know how these teachers do it. He goes, that it absolutely amazes me. I was hands off. I did not have to do anything with my kids because these teachers kept them engaged, kept them moving, kept them learning throughout the whole time that they were home. And he goes, and they were having fun and they felt loved. And he was just in absolute awe. And I get to walk around our gyms and see that same thing happening with our teachers here. They have done an amazing job to make sure that the curriculum is still rigorous and they're still there for help and assisting in any way that they can. So the teachers have just done an absolutely amazing job with all of the unforsaken word pivots that we've had to go through. So they've just done it absolutely amazing. Overall, it's a great area to be in, and IAS district has done really, really amazing things to keep kids in school and safe.
Thank you. And we have about a minute left, and we will entertain any questions the media has for us in the chat. And seeing none, thank you all. We are grateful for everything you're doing and for the media and for our speakers and for keeping up the positive attitude. We appreciate it. Thank you.
Thank you.
UPM leads the integration of bio and forest industries. Our constant aim is to produce more with less. That's what Bio4 stands for. Paper is true Bio4 product made of renewable and recyclable raw material. It remains sustainable throughout its whole life cycle. UPM Bio4, beyond fossils.